top doctors now explaining exactly how a narco test really works. If I could take you through exactly what a narco test means. India Today deconstructs exactly what they do as part of a narco test. In fact, this narco test would mean injecting a drug into a person, and then once he gets to a hypnotic state, there'll be multiple questions that will be posed. Let me cut across.
Well, thank you, Nabila. It's actually a medical mental condition of an accused where this test is conducted, and that's exactly find out the correct answer. The investigation that decides the investigative line. And here in this broadcast, at this setup, a dummy we have here, and in this setup joining me, the former ACP of Delhi Police, Ved Bhushanji, Dr. Saurabh, who's the MD at Vinayak Hospital, General Physician, joining me, Dr. Puneet Jain, a psychologist, and Dr. Puneet? Dr. Anuj Tripathi, who is also anesthetist. And that's a course, and also the forensic science laboratory expert, Adarsh Mishra. The first question to Dr. Saurabh. What is the state of, the physical mind, and also as a general physician before conducting a narco test to any accused?
Basically, narco means anesthetic. And in this test, what is done is that we give an anesthetic agent to the patient so that he is in a very semi-conscious state of mind. And the investigators can then put up questions to the subject and wait for his answers to come. They may be right, they may be wrong. So it depends on the state of mind. But yes, usually it is found that the patient tells the truth while this semi-conscious state of mind. But yes, it's only a corroborative statement that is coming from the patient, and it can lead to many other evidences. The subject...
That question will take from the expert, of course, the former cop. In the line of questioning that we have seen so far as Aaftab is concerned, the accused has already admitted his crime. Why this need of narco test analysis? And while carrying out these tests, what really substantial you think that will come out which will help in this investigation, sir?
Normally in three conditions, the police investigate and take such type of cases. This first case is narco analysis, other one is polography test, and third one is brain mapping. These tests are not conclusive piece of evidence, but whatever we can extract from the Aaftab means subject, that is admissible under 27 Evidence Act. And this is very crucial for investigation, but it's not for a normal cases. It is done in the rarest of rare cases because this case has very big dimensions. It's a very sensational crime across India. There is a debate on different angles, different measures, love jihad, so and so, so and so, but it needs some scientific evidence to prove the case beyond doubt. That's why we are conducting this narco analysis test. The experts will tell how the authenticity of this test, because we have taken permission from the court, because Supreme Court again and again told that life of patient is more important, subject is more important than the test.
Taken care of by the expert and doctors. And before we discuss the line of the questioning, sir, the forensic experts would say, Adarsh, that when it comes to the forensic collection of the evidences, we have seen the forensic team went to the spot collecting all the samples. What will they get in the narco test?
See, in the narco test, at least they will get some new clues after asking again and again multiple questions related to the incidents, like related to the murder of the Shraddha. So questions like what was the weapon used, where you have kept the weapon, and who were involved in the case, like in the murder.
How many people we usually see when the narco test is being conducted, and who are the team members?
See, generally there are 4 to 5 members, like one anesthesia doctor, one is forensic medicine doctor, then investigating officer or police officer, then forensic experts, psychologist, and anesthesia doctor.
And we exactly have the same team here, from a general physician to a psychologist. Dr. Puneet, when it comes to the psychological analysis of every statement that an accused is making during the narco test, how do you evaluate whether a person is actually speaking truth or he is actually cheating the narco test, sir?
We not only go according to what he is answering, we have to also check up the parameters. And according to the parameters as well as the answers which have been given, we take it as a whole. And then we decide whether the person is giving a right answer or not a correct answer. And if we find that there is any discrepancy, we may ask the same or similar question again after some time during the same test, based on which we may get a clarity on the question given put to the subject.
Dr. Anuj, what is the pre-narco general condition of an accused or of a person who's being on the test being conducted before giving anesthesia, and why this need of the anesthesia?
Pre-narco test conditions are relatively the common things which we use whenever we give the anesthetic drug. We have to examine the patient, pre-anesthetic examination. Same is along to the person whom we are performing the pre-narcotic test. We have to go all the tests relevant to the patient. If patient is having other psychological conditions, if patient his blood profile is okay, and we can give how much amount of the drug according to the weight of the patient. So these all things we consider first, then only we give the drug. And there are certain drugs which we use in these are sodium thiopentol, sodium barbiturate we can use, and we can also use scopolamine for these conditions to perform the narco test.
Which are called
truth serum, and relatively it is called truth serum. That's why it is called as truth serum.
But Dr. Puneet, can any accused even cheat narco test?
Yes, this narco test is not 100% true. There have been evidences, there have been instances where people have not given the correct answer in spite of the best effort. Because every person, every subject has got a different way of getting into a subconscious level of mind. Sometimes they have the ability so to cheat and not give the correct answer. So it is not a foolproof test. So we have to rely on all other tests also before finalizing the evidence.
So when this state comes out that if any accused is lying or he's speaking truth, how do you really observe the body movement, and how do you really analyze whether a person is speaking truth or not? Because similar we see in brain mapping or be it the polygraph test. Then when it comes to the narco test, what are the vitals that being in medical practice that you observe during the narco test?
Basically, it is seen that while doing these kind of tests, especially narco tests, if a patient is trying to, bluff the test, the investigation procedure, then his vital signs like his pulse rate, his blood pressures, his respiratory rate.
And that you can see on the monitor.
Yeah, we can see on the monitor the utmost line which is showing 77, 78 as the parameter just now. So these are seen to increase. And along with that, perspiration of the patient, sweating, and maybe the respiratory rate can, rise suddenly while he's trying to bluff the doctors or the panel.
And when it comes to the line of questioning, sir, you have observed this case very closely. Now, being a former cop, what are those questions that a police would ask to Aaftab during the narco test, and what would be temperament while asking the question, the body language or the tone, pace?
Body language, this is an unconscious state of mind. Investigating team prepares a questionnaire. Preliminarily, there were leading questions put up to the subject, and slowly, when they found that now it's a fit for answering the question in subconscious state, then they put the hit questions. That just like, तो आपने चाकू कहाँ फेंक दिया, आपने श्रद्धा को क्यों मार दिया, आपके क्या रिलेशन थे उसके साथ में, what happened उस दिन क्या.
While asking the question, do you even touch the subject?
Need touch करने का, it's no use of touch because he is almost unconscious state. Only his brain is working, and almost doctor will tell you.
All right, Ashutosh, thank you very much.